which can affect, we first need to call that viruses. Viruses affect 80%, and result to 80% of upper respiratory tract infection. Then the other one, we can have bacteria. The bacteria that we have group A Streptococcus. It is no more group B Streptococcus, which affect in the case of upper respiratory tract infection. It's instead group A Streptococcus, and it is mostly feared because it can result to a rheumatic fever, or it can result to a post-streptococcal glomerulonephritis. Is it clear? So group A Streptococcus. An example of group A Streptococcus in this case, Streptococcus pyogenes. While the example of group B Streptococcus is instead Streptococcus pneumoniae and Streptococcus agalactiae. Is it clear? It's Streptococcus pneumoniae and Streptococcus agalactiae, the causes of the group B Streptococcus, while group A Streptococcus pyogenes. Is it clear? Streptococcus pyogenes. Is it clear? So those are the different elements that you have to visualize, particularly if you have an upper respiratory tract infection. Another one which can be associated with upper respiratory tract infection, we have also Haemophilus influenzae. Is it clear? Haemophilus influenzae can be associated with upper respiratory tract infection. The next one, we have Mycoplasma pneumoniae, which can be associated with upper respiratory tract infection. Is it clear? We have the other one, we have Moraxella catarrhalis. Is it clear? Which can be associated with the upper respiratory tract infection, catarrhalis, which can be associated with upper respiratory tract infection. Is it clear? So after visualizing these different upper respiratory tract infection, we need to bring out now the next element. After the upper respiratory tract infection, you have now lower respiratory tract infection. Is it clear? Now, provided that the child has a lower respiratory tract infection, the microorganisms are going to still be based on the point of focus of the lower respiratory tract infection. And in that case, you can have microorganisms like the first one, we can have Streptococcus pneumoniae, Streptococcus pneumoniae associated with lower respiratory tract infection. We have also Haemophilus. In this case, it's a group B Streptococcus, not a group A. Group A is involved with upper respiratory tract infection, while group B Streptococcus is involved with lower respiratory tract infection. So we have Haemophilus influenzae, which can also be associated. And we have also viruses. Viruses are the major causes of lower respiratory tract in children, particularly respiratory bronchiolitis. And examples of those viruses, you can have respiratory syncytial virus, you can have arbovirus. Is it clear? And then the virus is the most common viruses involved with upper respiratory tract infection is the rhinovirus. Is it clear? Which is going to cause catarrh. Is it clear? So when you have any nasal congestion in children, you first have to think of rhinoviruses. Is it clear? Now, after visualizing the lower respiratory tract, the next one after the lower respiratory tract, we have also the GIT. Is it clear? Generally, the microorganisms that cause gastroenteritis are generally viruses, and those viruses are rotaviruses and noroviruses. Is it clear? We have rotaviruses and noroviruses, and they result mostly to secretory diarrhea. Secretory diarrhea is a diarrhea when you have loss of ions like sodium ion and chloride ion, even with potassium ion. That's why every time the child has rotaviruses infection, the major management is fluid rehydration and electrolyte rehydration via the ORS. Is it clear? So it is a case of secretory diarrhea. It's much more going to result to secretory diarrhea, and it is a major cause. It's 80% of infection in pediatric patients. It is mostly as a result of rotavirus and even neonates. Is it clear? So the next one on norovirus. It can also result, there are certain points in time where the viruses, that's rotaviruses, result to inflammatory diarrhea. And in inflammatory diarrhea, you have elements like fever, you have elements like pain during defecation, that's going to show you abdominal pain. Is it clear? We have other elements of gastroenteritis, and then on stool analysis you may see white blood cells and red blood cells in the stool. Is it clear? So all those that can tell you also that it is rotavirus. Rotavirus certain times causes secretory diarrhea, and other times can result to inflammatory diarrhea. Is it clear? Which is only managed with therapy sponging, that you reduce the temperature of the child, but don't give antibiotics. Antibiotics are only given provided that you have done a stool analysis or a stool culture, and you have a relevant microorganism that can tell you that that it is a bacterial or a protozoal infection. So after that, we have now bacterial infection associated with diarrhea. Is it clear? Now we need to know that what to know the bacterial causes of diarrhea, you need to differentiate the different types of diarrhea. Is it clear? There are 4 major types of diarrhea. The first diarrhea, we have osmotic diarrhea. Is it clear? We have osmotic diarrhea. Is it clear? The second type of diarrhea is a secretory diarrhea. Is it clear? Secretory diarrhea. The third type of diarrhea is the third type of diarrhea is the case of when you after secretory diarrhea, you have also inflammatory diarrhea. Is it clear? Inflammatory diarrhea. And then the fourth diarrhea is a functional diarrhea. Functional diarrhea. Is it clear? Now, under osmotic diarrhea, you have anything that can increase the intraluminal osmotic pressure. Is it clear? Anything that can increase the intraluminal osmotic pressure. Example, when a patient takes lactulose, is it clear? Or is lactulose is going to increase the intraluminal pressure, that is going to result to diarrhea. Or when you have a diarrhea after feeding, is it clear? Feeding of cellulose food, cellulose containing food. Is it clear? Because cellulose is going to increase the osmotic pressure when you eat cellulose containing food. Or when a patient has a lactose intolerance. Is it clear? Lactose intolerance, where the patient lacks a lactase or has overfed on milk. Is it clear? You can have a lactose intolerance due to a deficiency in lactase. You can have excessive accumulation of lactose, which is going to be broken down to lactic acid and also result to an increase intraluminal pressure, which results to an osmotic diarrhea. So those are the causes of osmotic diarrhea, and there are investigations that you have to evaluate when you have osmotic diarrhea. Is it clear? Particularly, that investigation is to measure the osmolarity of the feces, which is going to be less than 300 to 400 milliosmol per liter. Is it clear? Now, the next diarrhea is a secretory diarrhea. Is it clear? The secretory diarrhea, you have mostly loss of ions. Inside the secretory diarrhea, you have loss of ions, particularly sodium ion, potassium ion, and we have also chloride ion, which can be lost. Is it clear? So when you have this loss of the ions, you need to know sometimes also zinc ion. Is it clear? So the causes of this secretory diarrhea, we can first have the causes which are viral causes. Is it clear? And the viral causes, I've just explained that you have rotavirus, which is a major cause of secretory diarrhea. That's why every time you have a pediatric patient that has diarrhea, you always need to supplement iron and you have to rehydrate fluids, because the child is going to lose many ions because that diarrhea is mostly secretory from the rotavirus. Is it clear? We have also the norovirus, is it clear, which is going to be associated with the secretory diarrhea. Is it clear? That is for viruses. We have also enterovirus, but enterovirus is more of inflammatory diarrhea than secretory diarrhea. We have also enterovirus. Now, the next one, we have bacterial causes of secretory